With Bell Let's Talk Day just a few days away, it's time that we have the all important conversation about mental health, especially since mental health can affect daily living, relationships, and physical health. For today's show, we are through the roof excited because we have not one, but two of our guests from last season back with us to discuss the topic of mental health. We'll be sharing some experiencing and talking about ways that we have managed and coped through it, even while fighting with our chronic pain. Are you ready for another chronic pain conversations? Let's go. Hello, and welcome to another great show called Chronic Pain Conversations. My name is Khalilah Bruswell, and this is my lovely co host, Miss Sheriffa McLaren. This is a show where we have open and honest dialogue about chronic pain. We share on our experience, acknowledge the wide variety of chronic pain diagnosis that is out there, and look at ways to manage chronic pain. So, to get things started, we're going to do what we always do, and we're going to have a little bit of pain or pleasure. So, Rifa, my love, how are you doing today?
I'm actually doing pretty good. I can't lie. Rough start to the morning, but
Okay.
overall, it's a good day.
It's
I'm
a
claiming,
good.
I'm claiming it. It's a good day.
All right, that's right. You claim it, my love. So that
Yeah.
is beautiful.
How
You're
about you?
about
What's going
to, okay.
on?
I'm pain and pleasure.
You're both.
I'm both. The pain is my body is still hurting. It's I know that I was off last week, so
Yeah, we're glad
one,
to have you back.
I'm I missed you. You know I did. So I'm still recouping from the first surgery.
Mhm.
I'm doing really well, and but dealing with it, and there's still some soreness and some nerve and some after. And then I had COVID in the middle of getting ready for like preparing for surgery or after surgery. So that was definitely a
It
little
never
bit.
stopped.
So I won't say like I'm like pain level of 8. I'll be just like, I'm in more discomfort today. So I'm thankful.
Right.
But the pleasure is because we're doing something new today. And
I'm excited.
every time chronic pain conversations decides to like elevate, I always just,
Yeah. And I'm
right?
literally excited because we have not one but two guests.
And
And
they rocked the boat the last time that they
that's
were
why
here.
I'm excited because they're just like through the roof, like amazing. Like their stories, everything, their personalities.
Okay.
Just need to give
So,
them a show one day.
do we want to jump right into this?
Yeah, let's just bring them on.
Okay. So, who would you like to introduce first, my love?
So I'm gonna introduce Fiaba first.
Okay.
Fiaba was from season 3, episode 11 specifically. She was we're talking about children in chronic pain that day.
Okay.
She was a high level gymnast at an Olympic gym. And
Okay.
she shared with us her journey, starting at the tender age of 13, being diagnosed with chronic pain. She dealt with 2 stress fractures, 2 slip discs, at which it went undiagnosed for 6 weeks. And today
Jeez.
deals with chronic back pain, mainly muscle spasms that radiate from the top of her head to her feet. So I'm glad to bring her back into this conversation today about mental health. Now,
Okay.
tell us about our next guest.
All right. So, one of my favorites, we're going still back into season 3. We're actually doing episode 2 where we actually talked about mental health and chronic pain. So, why not bring back Miss Stephanie Dixon? Like,
Exactly.
in terms of Stephanie, she has literally been struggling with pain for like 27 years. She was misdiagnosed for 11 of those years. So, like, when we talk about chronic pain and the mental side of it, like, can you even imagine?
Yeah.
What's so great about her is that she's always been an advocate. She's always been a chronic pain conqueror. She's a fibro warrior. I remember when I first literally met her when we were both going to just check out like a possible trial, clinical trial. And this woman despite everything that she goes through, she still finds ways to just send me random pieces of love. And I think not only at the fact that she did the topic on mental health, but even as a mom, she has a different perspective when she sits down. So I think that today's conversation is going to be so amazing. So are you ready to bring them on?
I've been ready. Let's go.
Oh. If you guys ever want to know where Let's Go came from, that right there. Strike a pose. All right, let's do this. Miss Fiaba, Miss Stephanie, how are you doing today? This is so cool. We are so glad to have you, my loves. How are you doing? They both just shake their head like, uh-huh.
Thank you for having us on. I'm doing well today.
Yeah, it is so good to see you. Stephanie, how are you doing today, my love?
I'm okay, thank you. I wouldn't say it's my best day, but it's a good day, so that's good.
So you guys are having a little pain and pleasure yourself on your end. Well, let's start a couple of things off really easy because we're dealing with a topic that a lot of people, you know, it sometimes breaks our hearts every time we come back to January and we're ready to like do these conversations. And it's like in Canada, for those that are not in North America, Bell is a phone company that we have here. And I want to say, preferably within the last decade, they have really done this amazing launch called Bell Let's Talk, where they have had advocates from the athletic field, professional field, all around, where they've been doing their best to really just talk about mental health. And then I would have to say that once COVID came out, people really started jumping on it. But one of the things that we have to deal with is that not only are we dealing with our chronic pain, but we deal with chronic pain and mental health from a very different perspective. And so we wanted to come in and jump on this conversation at this time to be able to say, you know, let's bring awareness from a different perspective, you know? So I'm going to ask Fiaba a question, and I'm going to see if she knows this. So, Miss Fiaba, did you know that 1 in 5 young people ages 13 to 18 has or will develop a mental illness in their lifetime?
I didn't know that.
Does it surprise you?
No.
Why not?
Well, I think that mental health is just, it's so common in our in this day and time and in our society, especially in teenagers and children. I think we're seeing it a lot more, especially during COVID, because we're having isolation and increased screen time. And you know that, especially for a youngster, like being on Instagram and all those social medias, that is just, it's just so, it makes it so easy to compare yourself to other people, and to not just to other people, but to other people's best, putting their best foot forward, putting their best life images forward. And I think that is incredibly hard to keep good mental health when you're that age and you're seeing that all over the media. And it's, mental health is just so common, but it's just so not talked about. So it doesn't surprise me at all.
You had a struggle, not just with mental health, but you were dealing with your chronic pain, or learning about your chronic pain, or even better yet, putting yourself, like, you guys, you have to go back and hear a story, but as you know, and as an athlete, you placed yourself in a position which was battling mental health, or kind of like your career profession. Do you feel like youth and young adults are dealing with that as well? Or do you feel like we're equipped enough when, as a youth or a young adult, when dealing with stuff like that?
So do I think that they're dealing with,
how do you feel like, there's the one thing about, and anybody can jump on this, but there's the one thing where we've got mental health, and it's true. The statistics are 1 in 5 people will deal with it no matter what.
Yeah.
But then we've got the added bonus of having chronic pain, which increases the likelihood. And we're talking about youth and young adults who
Mhm.
are still trying to figure out their words, are still trying to figure out who they are still being led by so many people, adults telling them which direction to go into. Do you feel like maybe the numbers are smaller or not as recognized when we're dealing with young adults, children, and chronic pain and mental health?
I definitely think that the numbers are underreported. I know that as a child myself, I had a lot of mental health issues that I just didn't have the words to say them. I just used phrases like I'm tired or I don't feel good. But I didn't have the words to say, like, I'm dealing with depression, I'm dealing with anxiety. That just wasn't really modeled to me, and it wasn't modeled by my family or by society. So I just didn't have the words, and I just knew that I was not at my best, but I didn't know why.
Okay.
I have a question for Stephanie. As a mom hearing that statistic, what is your take on it?
Well, I'm not surprised. I think it's basically due to all the different things that are going on in the lives of teenagers. I can speak in both parts for myself, having been a teenager in that situation too, with the chronic pain. I think with the addition of the chronic pain, what made it challenging is that there was this, I guess, attitude from a lot of the adults that, you're young, you shouldn't be having these issues.
Right.
So, in addition to struggling with identity, maybe identity crises, whatever the issues are that teenagers are dealing with, because of course everybody's personal situation is different. But in addition to that, then now to add to it a chronic pain condition that is not being attended to really increases the lack of ability to express, as Fiaba was saying, a lack of ability to express what is actually going on, and actually, for me, increase the depression and anxiety that I was already experiencing. So that's from that perspective. As a parent, having dealt with at least one child so far, having gone through that as well, gone through his own emotional journey that did land him with some difficulties. I'm not surprised. It is a challenge. And I think as a parent, it's important to acknowledge slight shifts in the behavior of your teenagers, because those are the signs. So although they may not have the words to do it, there are slight shifts in behavior that definitely will be indicators. So to be more mindful, I would say, as parents, to what your youth are dealing with.
Okay. I have a question for you, Stephanie. Did you know that more than 1 in 4 adults living with serious mental illness also struggle with substance abuse?
I did not know that, and I'm not surprised.
Why are you
I'm
not surprised?
Well, substance abuse, I think for a lot of people with mental health issues, the one thing that people are looking for is like a numbing effect, and substance abuse often leads to that numbing effect. So I'm not surprised that people would use that to either escape from the depression or anxiety, or to feel as if that is actually the medication of choice, for example, that they would use to deal with any issues that they're having with their mental health. So I'm not surprised.
She's literally on point, you guys. Like if you I mean, like we have support groups and things like that, and the one thing that we're always hearing is it's just like they want the pain to go away. So you'll do whatever you have to do. And for some people, it's not considered substance abuse. It's just considered taking care of themselves. And I've seen, like, I've had my own family where they've been in a place where it's just give me the drug. We live in a world where you don't ever want to feel even the teeniest bit of pain, even if it's a pinprick or anything else. So that when you come across this is very interesting that, they're dealing with, I can see that they're dealing with the pills. Sheriffa, any points on this?
I actually have an experience with that, relating to the substance abuse at the time of when I was going through my mental health crises. I was dealing with surgery upon surgery due to my chronic ailment. At the time, kidney disease, and I was prescribed opioids. And that was at the time for me, as I thought, the perfect escape. I didn't have the pain, which was excruciating. And at the same time, it made me high, where I forgot about things and I just felt okay. After that was out of my system, it was right back into depression state. So I'm not surprised with that stat, seeing I kind of went through something like that as well.
For anybody on the panel, I have a question. If you're willing to share a very brief part so that people can understand where you're coming from, but everybody here is on this panel because we've already discussed your story and how you've gone through some stuff. But when you were while you were dealing with your chronic pain, even now, it doesn't matter what age, did you notice any signs and symptoms that made you realize that you were going through mental issues? And how did you learn to cope with it while you were dealing with your chronic pain? Everyone's just shaking, yes. I'll throw it out to Stephanie. Did you recognize that you were dealing with mental health while dealing with, that your chronic pain was triggering mental health? Let me say it that way.
I would say that it's kind of two parts. So I had some mental health issues prior to my chronic pain. So I was, again, a young person that dealt with a lot of anxiety. So I didn't see the difference as the pain increased and as my condition worsened. I didn't see the difference in my anxiety. What I did notice was the ups and downs in the depression aspect of things. I had a lot of lows, but I didn't really know what to do with it. So although I understood that there was something going on here, I wasn't clear on acknowledging what it was, having the words, and being able to actually engage with people that could help me. So part of what came out of that was like a social anxiety on top of it, which meant that I actually didn't reach out for help. So it was an interesting multiple fold where it's like I'm in this pain issue that no one believes I'm in, and then I'm in this depression, anxiety issue. And then because of that depression and anxiety, I actually did not know how to reach out and deal with these symptoms that were occurring.
Did you eventually get to that place where you learned how to deal with the symptoms and the signs?
I did. So in my early 20s, I did reach out to a doctor who did put me on medication. Unfortunately for me, I had a lot of negative side effects. And from there chose later on to look to more natural therapies to assist me in my mental health. So I have a certain thing I've looked at. For me, I have a few dietary triggers, which is so interesting. A lot of people don't realize that. So I actually have foods that if I eat consistently, it will actually land me into a depression. So I've discovered a lot of things about my health, working with other health practitioners that help me to distinguish what are my triggers, as well as to be on certain supplementation that assists to keep my mood balanced. So I'm doing really well. I would say I'm totally out. I consider myself someone healed of anxiety and depression. I don't consider myself as someone dealing with mental health issues. So
man, I've seen that.
Before I share, I'm kind of interested to know what foods put you in that depressive state. I'm a foodie, so I like to know these things.
So of course, again, everybody is different, and you need to know. And one of the things to be clear about, it has to do with our digestive tract. Our mood is actually developed in there. So if there's something that's throwing that off for you, you just want to look at what the relationship is. So for me, one of the key things is wheat. So not necessarily gluten, but wheat itself. So if I go and have a pizza, the next day I'm literally, in addition to having other symptoms, I'm in this very low mood. And if I have it consecutively, I land in what seems like a depression.
Ooh.
And I only discovered that out of removing it from my diet. So once I removed it from my diet for a whole year, and then I reintroduced it, I started recognizing the impact on my mental health. And I thought, wow, it was weird. So that's one of my key ones. I mentioned that one.
Wow.
To answer your question, Khalilah, I at one point recognized that my mental illness was serious when I decided to write a suicide note. But I didn't leave it for anyone to read. I think at that moment, I had my plan and everything. And I think at that moment, I kind of broke down and I called my mom. I was home by myself. I called my mom and I had told her, this is my plan, whatever the case is. And thank God for my mom. She went to her HR and immediately got help for me. I got a phone call from someone willing to hook me up with a therapist, and that's how I started getting help. So a lot of people don't have that cautious mindset to even say I need help, but I'm thankful that something within me kind of like right away realized it. Although I made my plan, I wrote my note, everything, to just at least call my mom and say, hey, this is what I'm going to do. And immediately it just opened up avenues where I could have gotten that help. So,
Wow.
yeah.
Fiaba, I know that you still deal with your chronic pain, but I know that, originally yours started off as a young woman, as a teenager. How did you recognize it? Because you were the alpha female going, I'm gonna push through this no matter what. So how did you get to that place where you were like, wait a minute?
So I have always suffered from anxiety. I think maybe some bouts of depression in childhood before I even had chronic pain. So it was hard for me to recognize that I was having mental illness because it was just my baseline. It just felt like my baseline. The thing that really set it off, or that made me realize how bad the issue actually was when I moved into college, and all of the sudden I couldn't hold on to everything. I wasn't in control of everything in my life. And I just been holding it all together for so long, and I ended up having a really severe panic attack one night, and I felt like my heart was racing out of my chest, and I couldn't bring myself down. And I tried calling my school had a hotline, so I tried calling the hotline. And it was just one of the worst nights of my life. And I'd been a psychology major, and I'd learned about anxiety and depression and everything, but I just couldn't fathom that was what I was going through until that moment. And I realized that I was having a panic attack. And then I started to look at the rest of my life, and realized that all these issues that I was having matched like textbook definitions of anxiety and depression.
Wow. Oh man.
I was gonna ask Khalilah if you want to share with us something.
Well, it's really funny because I was actually diagnosed with mild to severe depression before my chronic pain came in. So I had already developed certain tools and techniques that if I started reaching certain lows, like I would just be like, I'd literally send out like a blast text to people like, pray for me or call on me or check on me or put on different things. But um there were two different types of mental health that I was dealing with. There was the medicine that was making me suicidal, and then there was the interpersonal, who am I? Am I going to change? What's happening to me? What's going on with my body? Will I ever be the same? Can I love myself through this? Will my family still love me? All of these different things that I was going through. And so not only did I have something triggering me, but my situation in itself, the pain in itself was really unbearable. Um and just devastating. But when I had an actual suicidal like breakdown, maybe it was Thanksgiving. I just remember it was Thanksgiving weekend, and all I knew was, the fact that the balcony's calling me to jump over it, the fact that the knife is telling me to cut myself, the fact that, I just wanted to step in front of a Mack truck. It came back to the psychology class, which was, these are not the ways that I'm supposed to be thinking. And it came back to the child and youth worker side of me. And I was like, if someone called me telling me this, what would I tell them to do? And so as Fiaba was talking, I was like, you know what? They need to make psychology a class for everybody, just so that they can understand and be healthy. Like, as soon as she said that, I was like, it saved our lives. Like, it literally, the knowledge of taking a class for a career that saved my life.
Yep.
So I just reached out to a lot of people. And it was really funny because there were people that I was checklisting. I was like, do I want to talk to this person? No. Like, it's so crazy to be like, I could have 100 numbers in my phone and I only wanted like 3 people
exactly
to connect with.
Yeah.
And it was really, it was crazy that I had to actually get to a place where I had to voluntarily admit myself to the hospital to make sure that I was safe and I'd be breathing on another day. So that's kind of like how I had to cope. And most people don't hear that. Like, they're like, what do you mean? I'm like, I had to admit myself so that the stuff that I was hearing in my head would not hurt me.
I have a question for everyone. Do we feel like mental health and depression is spoken about in our chronic pain circles enough?
I'm not sure that the connection is there. It's spoken of, but I'm not sure if people really put the two together, or if they look, because I do have other friends in, at least in the I'm in, and they notice, they acknowledge that over time that there was something there before the pain in regards to mental health, and then after the pain, it made it worse, right? So there's an acknowledgement of it, but I don't think we actually discuss it enough, and really get to what kind of conclusions that we can support each other with from that perspective. So there's a tendency in the community for fibro to specifically speak of the pain. And one of the things that I've noticed is that the pain will increase the more you're in need of assistance with your mental health. So they play off each other. And that the more you address your actual mental health and well-being, the pain will shift. I'm going to use that word. It shifts. Your experience of the pain shifts. And I don't think that's addressed enough. I hear a lot of like, what medication are you on? And then a lot of people falling further into depression because the medication is only taking the buzz off the pain without recognizing that there are other issues that you're dealing with that needs to be addressed.
Stephanie, what do you think? Sorry, not Fiaba. So sorry.
I think that it's definitely not addressed enough in a clinical setting. I don't feel like the doctors that I've had have really pushed me to make a connection between chronic pain and my mental illness. That's something I had to kind of discover all on my own. And I have a great chronic pain doctor, and I have great, clinical support system, but it's fallen short. So, and as far as, I don't have a huge connection with the chronic pain community. But I definitely think that it's something that a lot of us forget to address because it's just not apparent. Like, we forget to figure it out in our own selves.
I think you both have hit.
I think it goes back.
I was going to say, you both have hit it on the nail, because you don't know that you have mental health if it hasn't been taught to you before, which is why, we were saying, I'm glad that we have something like about Let's Talk Day, but we need to bring it into the schools more. And there isn't that connection, because I've been in a lot of different chronic pain resources or courses, really crazy, like on how to take care of yourself with chronic pain. And they can talk about CBT, which is cognitive behavioral therapy, but they don't talk about PSTD. They don't talk about grieving. They don't talk about like your feelings. Nobody actually gets really engulfed or in depth. And no one also teaches you words. So when someone's saying, how are you feeling? It's like, I don't know, like, and it's kind of like taking all of our conversations from before when you're young and you're still trying to figure out the words, but you've got 30-year-olds who still don't know how to say, I'm angry, I'm upset, I'm vexed, I'm not okay with this, I'm not. So when we come now to our groups, Stephanie's right. Everybody's turning around and been like, oh, the pain. And it's weird, because if you know what depression looks like, you're looking at them going, do they know that they're unstable? But you have to also be careful on how you approach that to somebody in the group, because everyone's like, oh, no, I'm fine, but it's just the pain. It's fine, and it's like, but you're right. One is definitely increasing the other. Or one of the things that people don't look at is the fact that your medication can actually be the stimulant or the trigger, especially depending on how long you're taking it.
I agree.
And Absolutely. So there's so many different things, and we aren't having these conversations the way that we need to.
I was gonna agree with what Fiaba was saying and what you said earlier about your medication, Khalilah. A lot of the times is very true. The medication we take, we're not as educated on it to know that mental health to some capacity may be something you go through. So I think it's important that, again, we ask questions, we know what we're taking, be aware of ourselves, how it changes us, and see what can be done, right?
It's really interesting.
Sorry about that, Khalilah. I was just going to add, and be aware of all of the side effects, because I know when I went on medication, actually for my anxiety and depression, the medication put me into suicidal tendencies. So and so interesting that a lot of us have done psychology. I have a psychology degree as well. It was that degree that actually helped me to acknowledge and recognize, oh, it's possibly the medication I'm on, why I'm at this level now, because we typically figure that these things are to help, and they are in general. But when you're dealing with a lot of different health issues, you have no idea how your body is actually going to react to things. And so if you're not aware that these are potential issues and concerns, then you don't know what to bring to your doctor and say, you know what, perhaps I need a lower dose, or perhaps I need a different one, because now your whole mood has shifted, your ideations have shifted, and perhaps the pain hasn't shifted in our situation where we have both. So it's definitely important to be mindful of all that.
I'm going to jump on that, because I actually just had a very interesting experience with my surgery that I had a few weeks ago. So the medicine that literally put me in the hospital was gabapentin. And they wanted to give it to me for after the surgery. And it's really funny, because here in the States, they literally send your prescription directly to the pharmacist. And no one had originally had a conversation with me about what the meds were. They're just like, we're going to send it to the pharmacist. We're going to pick it up. So I pick it up, spend a whole bunch of hundreds of dollars. And then I come back, I pull it out, and I was like, wait. And they're like, what? And I said to them, I ended up in the hospital, suicidal thoughts, because of this. If I had known about this, we could have had a different conversation, because I'm taking Cymbalta, right? And because Cymbalta and gabapentin do two different things, we had the agreement. They're like, we need you to try it because it's going to help your nerves during your recovery. But if X, Y, and Z, if these symptoms show up, we need you to stop it and tell us. not even the first weekend, like 5 days in, I was having the dreams again, like really wonky dreams. And they were like, okay, it's off. So we have to have another game plan for the next time that I go around for my next surgery. But, you know, we do need to be, we always talk about it. You've got to be an advocate for yourself, know what works, know what doesn't work, and be okay in understanding that even though you've gone to a physician, you are the person that's lived with your body your whole life. So if you know something's off, you got to inform them and not just be like, well, you went to school with a PhD. I am the expert of the life of Khalilah. Like, you know what I'm saying?
Absolutely.
And yeah.
100%.
And we can certainly talk about that, something that you can take to assist with those nerves.
You do. There's other things. I have a question for you because we are running out of time. So we have people that are going to be watching our show who may not be dealing with mental health, but their family and friends are dealing with chronic pain. And not only have they seen a shift in, you know, their pain, but they're now seeing a shift in their mood. What kind of advice would you give to somebody, or how would you have liked to be approached in those moments by your family and friends? You know, because you also have to be careful. Like, we don't just want to acknowledge that we have it if we don't even know it's in ourselves. But if someone was to be like, I have my friend, I have my family member, how do I approach them? How do I show them love? How do I say to them, I'm concerned about you? What would you guys have done? How would you have liked to have been approached?
If you don't mind, I'll go. I think one of the first things we can do as family members is to actually communicate and say something like, I notice that you seem to be feeling this way. I notice that this is getting you down, and really keep a conversation open. Because I think one of the things that we do as the person dealing with it is we're in denial. We're in denial of, because there's so much stigma, especially on mental health issues, right? So there's a denial. So for the other people to be just checking in regularly without the request, like, do you want me to, but to actually engage in, how are you doing? What's going on? And instead of saying you should do this or you should do that, perhaps offer, here are some things have you thought of? Just the way we speak to one another, and to let them know that you're that person who will be checking in, and encouraging them to do certain things. I think even for family members, I think they feel like they can't even do that. They can't even encourage you because, oftentimes people with depression in particular, you say, why don't you do this? And they say, well, I just can't. Mm-hmm. So there becomes this lack of, I guess in a way it's grace. It's to have grace for one another, to continually be that person for them, and in slow steps, remembering that it takes a lot to get out of our heads, because that's where a lot of this stuff is, right? It's all those the voices that are going through our heads, and it requires this other voice to be consistent. So your family member's voice of consistency, of how are you doing? Let's do something together. Or here's a mindfulness technique I found that might really help you just focus away from, these thoughts and these issues. So just, be supportive in that way, and be that person just to check. I think to complete my thought is for family and friends to remember that the onus is on the individual. So I know a lot of people feel like, had they known, had they done something. And the reality is that we have to take responsibility for our mental health and well-being. And so for them, it's to be a space, of encouragement and, consistently uptake, but really and truthfully, if we want to get out of it, at some point in time, it's our choice we have to choose it. If we don't choose it, it doesn't matter what our family members do, right?
Right. I'm thinking about young people, and I agree with what Stephanie had said about offering to do something with them, get them out of the element of being home, locked up in your room. Let's do something fun. I mean, now it's hard because of COVID, but even the simplest of things, come over, play some games, something like that, I think, just to get them out of their head a little bit, might even help. I think about, Fiaba at 13, what would she have maybe wanted other than someone pushing her to continue gymnastics? Nothing's wrong with you. Let's go out for ice cream. Let's do some stuff. So I think a lot of it is trying to just be a support, maybe trying to get somebody out of their head and more just relax mode, not thinking about what may be going on in any capacity.
And as a parent, just so I just wanted to write on that there, as a parent, if you notice the difference in behavior, it is important for you to be strong and make choices for your youth. So what I did with my son is like he went to a one-on-one counselor, he went to group counseling, and at some point we do have to step back and say it's still up to that youth to choose, and that's very challenging as a parent, to do as much as you can, to throw it all in there without throwing the hands up first. Because I know for a lot of people, they're like, I don't know where the resources are. Find them for your youth, because your youth does not know what to do. A 13-year-old, a 14-year-old, a 17-year-old, they do not know where to reach. And it's important for the adults in the family to be able to say, I'm going to reach for you. Yep. Here it is. Even if they're resisting, I'm going to drop you. I'm going to take you. Even if they resist the person, because with my son, he did not speak to his counselor for at least 6 of the 10 sessions. He was not opening up, but keep going. Like, just keep at it as best you can to know that you have provided as much as you possibly can, and then still know that it's in their hands. I had to let go and let him determine what was going to happen with his mental health. And he has come straight through it. It's been beautiful. But in those moments, it was like I eventually had to say, I've done everything I can do. It is now up to him.
Thank you. Great points, Ms. Fiaba.
I think it's so important to model like good coping mechanisms and going to therapy. It's so easy to say you should go to therapy. You should do this, you should do that. But to actually model that, especially if you have a child or you have family influences like siblings, to be able to model that and to have open conversations if you feel comfortable about what your process is, what you're going through, how it's helped you, and also things like acknowledging that you don't always want to go to therapy. Sometimes it's boring or sometimes it's hard. Sometimes you just have to get out of your everyday life to go talk about your trauma, and that's not always the most fun thing. But really being open and acknowledging, having open conversations about that is something that I would have loved to have been modeled when I was younger, and eventually friends who did do that were what got me to go to therapy.
Wow. Great points, ladies. Okay. I'm going to give both Fiaba and Stephanie one moment. I'm going to ask you guys a question, and I'm going to give you in 30 to 1 minute, I'm going to ask you to answer this really quickly. And Fiaba, I will start with you. And the question is what encouraging message would you leave for someone right now who is watching and struggling with both chronic pain and mental illness right now? In less than a minute, what would you say to them right now?
Well, what I would say that might be encouraging is that if something isn't working, there's always another angle to attack it from. There's always somewhere else you can go. But if you're attacking it through physical therapy and that's not, you're hitting a plateau, it's okay. It's okay to attack it from a different angle for a while. And the more angles you can find to attack it from, the more variety and diversity you have in.
I love that. She blanked out right at the right time, but she'll be back. Stephanie, in a minute or less, tell us again, what encouraging word would you leave for someone who is watching and struggling with mental health right now?
Perseverance and grace and compassion for yourself. It is a journey. Healing is a journey. And just as Fiaba was saying, look to it as a holistic aspect of things. There is just one way. And so if that one way isn't working, look to another way. And I think one of the things that we all need is to understand that for ourselves is to really have patience grace and compassion and perseverance, because it's and that there is a silver lining. There really is. There is a light at the end of that tunnel, and to keep going. Keep going.
Awesome. Both amazing words of encouragement. Thank you. Thank you so much. I know we're not going to get Fiaba to jump back in. She is in the background. We are going to say goodbye to Stephanie right now so that we can close things off. But we're going to ask for both you and Fiaba to both come back on. Actually, we're going to give you one brief moment just so that our followers, if they want to, if there's a way that people can get connected with you, would you like to leave your Instagram or your social media information so if people want to get in contact you they can? Fiaba, you can go first, my love.
My Instagram is Fiaba_Zakarian. That's just my full name with an underscore.
Okay. Stephanie, if someone wants to get in contact with you, is there a way of doing that?
I do have an email address. I should have put it there, but it is stephiemarie4@gmail.com. I'm not sure if you still have it, if you want to list it up beside my name, or they can reach me via phone. I'm very old school. So I'm okay with you putting out the information.
Awesome.
Yeah.
Ladies, once again, from the bottom of our hearts, thank you for joining us and having this conversation, especially on such imperative week with Canada and North America dealing with what it's dealing with and bringing up this issue. Mm-hmm. So please stay in the background. We're going to remove you from the front and we'll just close up with you guys afterwards, okay? Thanks. Sheriffa. Oh, what is that for, my love?
It's just our first time doing the show like this. It was amazing. It came at the greatest time, like we said. Bell, Let's Talk for us here in Canada is tomorrow. So it came in perfect timing. And it was real conversation. It was honest conversation. It was a vulnerable conversation. So I'm very happy. I'm thankful that our guests opened up about mental health. We as hosts opened up about our mental health. And I'm hoping and I know that what we talked about here today is going to reach somebody at the very right time. And I'm hopeful and I know that it will help somebody get through whatever it is they're going through at this very moment.
Oh my gosh. I love today's conversation. Everything that you said, I'm just going to say ditto for. Just to wrap things up, to my knowledge, there are no chronic pain mental health lines, but there are chronic pain support groups and facilitators, and there are mental health lines.
Right.
And your facilitators and your mental health line people have been trained to listen, to assist, to resource. So even if you don't feel like you've got family and friends out there, go to a pastor, go to a teacher. The amount of resources that are out there are endless. So if you know that there's been a shift in you and you don't know why, but you want some help and you still want to keep it personal or public, there's options for you. That would be the only thing that I want to say.
Absolutely.
And I just want to take us into our keep it moving moment, if that's okay.
Go right ahead.
Yeah. Okay. So let's do this. I like today's Sheriffa picked this one out and she always says perfect timing when she does this, you guys. Today's mental health says, today's keep it moving moment says, what mental health needs is more sunlight, more candor, and more unashamed conversations. That comes from Glenn Close. And I would really hope that what we did today is so in line with that keep it moving moment. And I just want to say that to you guys, more sunlight, literally get vitamin D, get sunlight, even though it's cold in some places, opening up a window and just letting light in makes it, an unashamed conversations.
Yep.
If we had stabbed ourselves or if we were bleeding or we were bruised, we wouldn't have no problem running to a doctor or to an ambulance or to a friend saying, mend me up.
Mhm.
And just because mental health isn't a physical thing being seen, if you are bruised or broken or just need bandaging on the inside, you can run and have an unashamed conversation because, again, everybody is dealing with it and you don't need to be ashamed.
Absolutely.
Mhm.
Guys, that is our show for today. My name is Sheriffa McLaren Thomas from YouTube The Thomas Life.
Oh, sorry. I'm Khalilah, aka the Overcomer.
With it being Black History Month next week, coming up, we are starting off the month with guest Fadia Jerome Smith next week,
Yay!
12 p.m. Eastern Standard Time, and that's 9 a.m. Pacific Time. She has had one failed pregnancy in 2010 before giving birth in 2012, all while fighting a difficult battle with an undiagnosed kidney disease. She was finally diagnosed in 2015 and started dialysis in 2016. Join us on Tuesday to hear her incredible story and how things changed for her amazingly and gave her another chance at life.
Wow, you guys. I can't wait for her.
I'm excited. And this was kind of personal for me and Khalilah, so we're really excited to have her on the show.
Okay. So we just want to say thank you for joining us for another episode of Chronic Pain Conversations. Please be sure to follow us on Facebook, Instagram, and CP Conversations. And just remember that if you are a business and or service that helps support and or caters to our chronic pain community, such as a clinician, a physician, a mental health resource, a health supplier, or someone that advocates for patient rights, we want to invite you to be our guest and to promote your business. So please submit your information by visiting our social media Visio bio. So that's it, guys. Thank you for watching. And remember that Chronic Pain Conversation is the show that enlightens and advocates about chronic pain. We hope that you have an amazingly, amazingly blessed week.